friends, welcome to my show, Podcast with Shilpa. Today we are going to talk about kids' health. We are privileged to have Dr. Grimes with us, who is an expertise in pediatric care. Before we start our episode, I would like to remind you to share this video with as many as people you can, because you could be helping a family or a parent who need guidance for their child health. Even a single share can make a huge difference in someone's life. Now, let's get started. Hello, Dr. Grimes. Welcome to my show, Podcast with Shilpa. We are so excited to have you on my show.
Thank you for having me. I'm excited to be here.
Yeah. And so we are going to talk all about kids' health today. That is very important, I think. So let's start. Recently, I read an article that says that 1 in 4 kids have constipation issues. Is it true?
I believe it is true. I see a lot of kids with constipation every day.
Okay. So what are the symptoms of constipation, or how do the kids act when they feel constipated?
Yeah, so typically kids who present with constipation, they're going to have straining when they're going, so like bearing down, feeling like it's pain when they're trying to get it out, and then their stools are going to be hard. Typically they're like hard balls, or some families describe it as clogging up the toilet. All that can be constipation. Now, some kids do not poop every day, but that does not mean that they're constipated. It just means they poop every couple of days, and that's okay. It's mainly the straining and then the hard balls.
So, like, can you tell any top 5 food that helps to relieve constipation in kids?
I like the pea foods. So any food that starts with a P that has a peel on it is really rich in fiber. That fiber helps kids go, and so it makes it easier for them to poop. So those are foods like prunes, pears, apples, peaches. Any of those foods that have the P and the peel are really good for them.
Good for them. And is there any like top 2 drinks that kids can take to relieve constipation?
Water and water. Yes, those are the top 2 drinks.
I was expecting some other answer.
No, it's always going to be water and water, because the other drinks can cause constipation. And so if kids are drinking their water, it's definitely going to help.
And like lemon water, is it good too?
That's fine.
That's fine.
Lemon water. Yep. And some kids, like especially babies, if they get constipated, will tell parents to do a little prune juice, a little pear juice. Those are okay if a baby is constipated, but not something I would encourage families to do all the time.
Okay. And is the laxatives, they are safe to use?
Yes, they are. So especially if a kid gets to the point where they are constipated, definitely okay to use something to help them go. And so the one I typically recommend to families is Miralax. It's very safe, and it's been studied in kids. I've seen kids on Miralax for a long time and still okay.
Okay. And like what to do if my child has a severe constipation, that what can be done for that?
So besides trying those pea-rich, fiber-rich foods and drinking their water, if you tried all those things and the child is still constipated, I probably would recommend having them see their doctor, just so that they can come up with some more strategies and techniques to help them. And then, of course, the last resort is a pediatric GI doctor, so someone who specializes in the bowel and gut of kids. And so some kids need to go there in the end.
Okay. And like what are the most important foods that people think are good for their gut health, but actually they are not?
I would say I have 3. So the first one would be flavored yogurt. So a lot of the yogurts have sugar added to them, and so typically too much sugar is not the best. We think yogurts have probiotics and they're good for us, but just trying to be mindful of the yogurts that have a lot of sugar. Second one would be granola bars. So we think of granola as having high fiber, good for your gut health, which they are, but once again, a lot of granola bars can have added sugar. And so typically if you look on the back of a food label, if it has less than 10 grams of sugar, then you know, okay, this is probably an okay granola bar. Anything greater than that probably would be too much sugar in that granola bar. And then the third one is red meat. So I'm never going to be a pediatrician that says your child can't have red meat, you shouldn't eat it. But there have been some studies that have shown if you increase how much red meat you're eating, then you could also increase your risk of colon cancer. So just being mindful of how much red meat is in your diet.
And if we are talking about fever, if my child is having fever for 2 days, then what should parents do?
So the first thing I would say is relax. So it's okay if your child has a fever for a couple of days. I say fever is our body's way of fighting off something. It's doing what it's supposed to do. So I actually don't get too worried about fevers. And so, make sure your child is relaxed, make sure your child is hydrated. And then of course it's okay if they can do some Tylenol or Motrin kind of as needed, not necessarily to treat the fever, but to help them just feel better.
Better. And like, what are the three most important food that can help to build the child's immunity?
So I would say kind of like a broad range would be just fruits, vegetables, and then I'm always going to say water, even though that's not a food, all that's great. So I don't have a personal, like these are the exact foods you have to eat, but if you're eating from the rainbow, colorful foods, all those fruits and veggies, that's going to naturally build up your immune system and help you fight off things.
Okay. And if this is a season for cold and cough,
Yeah.
so what are the natural ways that can help the children to get relief from the cold and cough?
Sure. So it depends on the child's age. So if a child is usually less than 1, I would say natural things are like the saline and the suctioning out the nose. You can also do a little bit of the Vicks on the chest at night. I really like humidifiers, more so the warm mist humidifiers. Or if you don't have a humidifier, you don't have to go out and buy one. I say just go to the bathroom, turn the shower to hot, close that door. That hot steam helps things open up and drain. And so that's typically what I recommend for kids who are less than 1, but kids who are older than 1, then it would be safe to do honey. So I really like local honey on a spoon. You can do it every 4 to 6 hours or so, and that really helps coughs even better than over-the-counter cough medicine. And then older kids can also do teas. Chamomile tea really helps the cough and kind of just helps kids feel better. It also soothes the throat as well.
And is there any vitamin that kids can take on a regular basis that can help to build their immunity and that can prevent them from cold and cough?
I really like elderberry. So there have not been any studies that have shown that elderberry for sure boosts immunity, but I've had a lot of families say that it helps. So especially if a family comes to me and say, hey, my kid's getting sick a lot. They started kindergarten, they're in school for the first time. I say, okay, totally okay to try elderberry. Now there are different forms. So there's liquid, there's chewable, there's dissolvable on the tongue. And so I don't have a preference for which one, but I do prefer natural local elderberry. And so some families have found that, oh, their friend makes elderberry, or Harris Teeter sometimes has a local section that has elderberry in it, or there's the farmer's market. So all different ways to find natural elderberry, but that's totally okay to do every day during cold and flu season just to see if it helps.
And I recently read somewhere, I don't know, I think 2 years back or something, that child obesity is a serious public health concern in United States. Is it true?
Yes, it is true. We are seeing an increased risk and, just number of kids who have obesity. It's multifactorial. There are lots of studies trying to figure out why this is the case, but we are definitely seeing increased cases.
Increased cases. And what are the causes of child obesity?
Yeah, it's multifactorial, like I mentioned. So sometimes it's environmental. So what's going on in the family household that's contributing to obesity. Sometimes it's values and how families have grown up and raised their kids, or parents, kind of back in the day. It can be lots of screen time or lack of exercise, or even lack of access to healthy foods. So all those things can kind of contribute to a child not growing in the way that they should.
They should, yeah, right. And what are the health risks that are associated with the child obesity?
Typically, it's as kids get older. So, if someone has obesity, it can increase their risk of diabetes, high cholesterol, high blood pressure. And so the reason that, us as pediatricians and doctors like to focus on it a little bit more in childhood is so that as kids get older, we can hopefully prevent these kind of things from happening in the future.
And what are the psychological factors that are associated with childhood obesity?
What do you mean by that?
Like, what are the factors, like some kids have anxiety or something. So are those factors kind of related to the childhood obesity?
They can be. So especially if a child is dealing with mental health issues, they might not feel the best about themselves, which in turn affects their eating habits. So it's kind of like a cycle and everything's related. And so we have to help at each point in the cycle so we can break it.
Bracket, yeah, right. And how can parents help to prevent childhood obesity?
I think one of the main things I like to tell families is being a mirror. So, your child is not going to want to be healthy or active if you're not healthy or active. So it's important that, you guys are doing activities, even as a family, because, that family bond is important. And then you're also being active together. And so that's one thing that, families can do. And also, limiting the amount of screen time. It's hard because kids are in school, screens are everywhere now. And so I'm never going to tell a family a kid cannot have screens, but we just have to be mindful about how much screen time we are doing. Typically, I like families to use like 1 or 2 hours as the max outside of schoolwork as their screen time limit. And then, anything outside of that, getting outside playing, whether it's on a sports team or just at your house, those kind of things will help keep kids active and kind of help with preventing of obesity. And probably the last thing, of course, is the healthy food choices. Like I mentioned earlier, like shopping around the outside of the grocery store, those rainbow foods, all those things are really good to help with healthy eating habits and helping prevent obesity.
Obesity. And like you said, that screen time is leading to the obesity, right? So like what are the consequences for kids for having excessive screen time?
So it can affect kids in a number of different ways, whether it's their vision. I've seen some kids have vision issues because they're on their screens all the time, whether it's not able to interact with people because they're on the screen so much they don't know how to regulate their emotions, things like that. Whether it's they're missing out on doing other things in life, especially for teens. Sometimes they get in their rooms, they close themselves off, and they're on video games all day, but the world is happening around them and they're missing out on that. And so those are kind of the things that I've seen with too much screen time.
And like what are the best ways to reduce the screen time for kids?
I think one of the number one ways is having a routine for your child. And so doing the same thing every day so they know what to expect and not necessarily building a big amount of screen time in that time. Because if your child is in school, doing after school activities, sports, is busy, there's not really a lot of time for screen time. So the routines really help. And then the second thing I would say is kind of like what I mentioned earlier too, is being a good mirror. So if you're on the screens a lot, watching TV on your phone at the dinner table, your child's going to think that's okay and acceptable. So trying to mirror those healthy things like, hey, maybe at the dinner table, we'll put our phones to the side. Everybody talk, tell me about your day instead of being on the screen or eating your dinner, watching TV. Those kind of things are helpful.
Yeah, kids always follow us.
Exactly.
What the parents are doing.
Exactly. So. Even when you think they're not watching, they're watching.
They're watching us.
Yes.
Yes, right. And like, what are the best ways to handle my child's tantrums? Like he's doing some throwing kind of tantrums. So what is the best way to handle them?
Sure. I think it depends on the age. So first, I want to say that tantrums can be normal, especially for kids who are about 1.5 to 4 or 5. They, especially younger kids, they don't have the words to vocalize, I'm upset because, so they throw tantrums. So just want to start by saying tantrums can be normal and it does get better in time. So give yourself some patience and some grace. The main thing that really helps with tantrums is trying to prevent anything that leads to the tantrum. So if you know your child gets hungry and they throw a tantrum, having snacks around. So anything that causes a tantrum, I try to tell families to step away from whatever could be a trigger. And then the second thing is also like if they're actively having a tantrum, give them some space. So walk away, don't engage because they're going to think, hey, if I tantrum, then I'll get my parents' attention and I'll keep doing it. So give them some space, come back and check on them, make sure they're doing okay. And then outside of while a child's actively having a tantrum, so on an everyday basis, trying to get the child to understand their emotions and use their words to express themselves. So even if they're doing well, how are you feeling today? So they can use those words to vocalize their upset in the moment instead of having a tantrum.
And like as a pediatric, how many hours of physical activity you will recommend for children in a day to prevent the obesity or to prevent the screen time?
Sure. The more the better, of course. So if your child's outside all day, great. But that's not always feasible. So typically I'll tell families at least 30 minutes of sweating activity. So something that kind of really gets your body moving, you're sweating. So at least 30 minutes, 5 times out of the week. So that's kind of 2.5 hours total throughout the week. But once again, the more, the better. So if your child's getting out there more, spending more time outside or doing something physically active, that's always going to be better.
And when should the child be evaluated for obesity?
So that's kind of tricky and hard. One way or reason that a child would want to be evaluated is its parental concern. I always stress parents when they come in to see me, they know their child the best. So if they're worried about their growth or their weight, that would be one reason to see the pediatrician. The second thing is, bringing your child to their checkups. So when you come for checkups, we typically will show you a growth chart and kind of see how your child is growing. If us as pediatricians notice something, then we'll kind of start the conversation from there as well.
And coming to the breastfeeding, how important is the breastfeeding for the mothers and the babies?
Yeah, breastfeeding is great. I always recommend breastfeeding. Number one, it helps with a bond. So mom and baby get to bond with each other. They spend a lot of time together. Also with breastfeeding, mom has antibodies to certain diseases and things like that. And so especially those first 6 months when the baby doesn't have their own antibodies, mom's antibodies pass through the breast milk and helps prevent the baby from getting sick. I will also, on the flip side, say if you are not able to breastfeed, that is okay. So even though breastfeeding is great, I don't push it or force it on families because some moms can't breastfeed. We just care that a baby's fed. So however that is the case, then that's okay by us.
Nice. And if we are coming to the breastfeeding, what are the key points that the breastfeeding mother should keep in their mind?
Sure. The first thing is to give yourself some grace. Breastfeeding is hard. I often tell families it's the hardest thing to start, but the easiest thing to give up. So it's going to take some time. So give yourself some grace, give yourself some patience. And then also making sure mom is taking care of herself. So she's eating what she's supposed to. She's staying hydrated because she has to be in a good space in order to breastfeed her baby.
And if we are going to talk, what are the 3 foods that a breastfeeding mother should take in order to have a good produce of the milk for the babies?
It's similar to kids, what I say kids should be eating. So fruits and vegetables and water. So as long as mom's doing those healthy things, those are good. Making sure she has a diet that's rich in protein and enough nutrients is also important. Some moms will do the body armors and things like that to kind of help with their breast milk production. And so the things that she would typically eat that are healthy, I would say those would be the things.
And how long a baby should be fed at one time? How long do you recommend?
For breastfeeding total? Okay.
Yes.
So typically it's going to depend on the baby. Some babies can breastfeed longer than others, but typically we'll say 6 months to a year is a great length of time for breastfeeding. A lot of moms will do more, so 2 or 3 years, but usually a year or so is kind of the sweet spot for amount of time that moms will breastfeed, because after that, that's when we start to transition to regular milk, things like that. And so the time that the breastfeeding is going on starts to dwindle out.
And how many times a day a mother should breastfeed her baby?
Yeah, it depends on the baby's age. So newborns, they will do cluster feeding. So they'll feed 8 to 12 times a day. So quite frequently. And then as the baby gets older, they get some months on them, then usually it's 6 times a day, and then eventually 3 times a day. And then those 3 times a day of breastfeeding gets traded out for milk or water at their meals.
Right. And if we talk about the premature babies, so what should be given to the premature babies for their development?
So the main thing is just making sure they're having something that they drink that's really rich in calories. A lot of babies who are born early are on the smaller side. So we want to make sure they're getting enough calories and nutrients. So oftentimes those, especially really early babies, will have either formula or something like that that has more calories to make sure they gain really good weight. And then a lot of babies who are born early will also be on a vitamin every day. And that's just to make sure they're getting all their nutrients that they might not have gotten since they were born early. So those probably would be the two things that babies need nutritionally who are born early.
Born early. And do we need to keep some points with a premature baby as a mother or as a father? Do we need to keep some things in our mind?
Like their development, that kind of thing?
Yes.
Yeah. So since the baby is born early, sometimes they might meet their milestones a little bit later, and that's okay. And so just kind of being mindful, especially when you're coming to the doctor's office, if you have concerns that they're not meeting their milestones, let your doctor know so that they can maybe refer them to some therapy or services to help keep them on track. So that's one of the main things outside of nutrition, is just to make sure the babies who are born early are developing like they should. And meeting all their milestones.
And how important is the annual checkup for kids?
Oh, it's very important. So it's going to depend on who you talk to. Some people are like, oh, they're fine. They don't have to come to the doctor every year. But I love to see kids every year. I just want to make sure that they're growing well. That's kind of like I mentioned earlier, time to look at their growth charts, checking about school, sleep, their eating habits. And, you know, that's also a time for you as a parent to bring any concerns to us about, hey, I'm worried about this, or can you give us some tips on this? That can't be done unless you come for your checkup.
And how can I track my child's development?
Let's see. I'm trying to think. There is an app. There's called the CDC Developmental Milestone Tracker, I believe. And so you can see your baby or
that is Center of Disease
Control. Yes.
Right.
So they have an app that tracks milestones, and then you can see your child's age and then kind of do the milestones from there. But outside of that, the only other thing I can think of is coming to see us, because then we will tell you if they're meeting their milestones.
That's right, really right. And coming to the vaccinations that are, I think, very important for the kids. What are the vaccinations recommended for children?
Sure. So there are quite a few vaccines that kids need and we recommend, from the hepatitis B vaccine when babies are first born, all the way to the tetanus vaccine when kids are like 21, and we see kids through 22 in college. And so there are lots of different vaccines throughout that time, and so going to your doctor, they will have a schedule for you that tells you which vaccines to get at what time.
And which is the one most important vaccine that every kid must have in United States?
So all the vaccines are important and equally important, so I can't pick the most important one, but I can say that we are going into cold and flu season. So currently, the most important ones to think about doing this season would probably be flu. If your child is 6 months or older, the COVID vaccine, similar, your child has to be 6 months or older. And there's a new RSV immunization, and so that's for newborns up until 8 months or so. Can be for older kids if they have some kind of issues like heart disease or asthma or those kind of things. But those would probably be the three most important ones currently in this season, because we're in cold and flu season.
And why is flu vaccination recommended every year?
Because the flu strand changes from year to year, so they have to cater and make the vaccine based on the previous strand from the previous year. And so that's why it's something that you get every year. It's not like some of the other vaccines where you might get one or two and then you're done for life, because they want to make sure that you have the most updated flu vaccine based on the strands that are out there. So that's why it's every year. It's important to get it every year. Not only because, but I see a lot of kids who get really sick from the flu. So the vaccine doesn't necessarily prevent you from getting the flu, but it probably will help keep you from getting super sick, going to the hospital, or it might even help shorten the duration of the flu if you get it.
Okay. And talking about the HPV vaccine, what is HPV vaccine?
Yeah, so HPV is human papillomavirus. It's a common virus that's seen all over the world. It's one of the viruses that we have out there that's known to cause cancer. So the vaccine helps prevent that. Now, 80% of the population will be exposed to HPV at some point in their life, so it's very, very prevalent. And so that's why the HPV vaccine is very important. Now, oftentimes, no matter where you're at in the U.S., it's not often required by schools, but it's something that we definitely recommend, because it's actually the only cancer-preventing vaccine we have out for kids.
So at what age HPV vaccine is recommended for children?
So typically we started actually fairly early before kids would ever be exposed. We started as early as age 9. The reason we do that is because kids have a really robust immune system. So if we give them a vaccine when they're younger, they have these bigger antibody responses, which is really good. Previously, the vaccine was approved to like the teens, the 20s. Now it's approved to the mid 40s. So you can get the HPV vaccine anytime during that time range. The younger, the better. But to keep in mind, if you wait until after age 15, you have to get 3 HPV doses instead of 2. So that's just something to keep in mind as well.
So if we get it early, then how many doses of HPV vaccine are required?
So if you start anytime between 9 and 14, you only need 2 doses. If you start 15 or older, you'll need that extra 3 doses.
Does the HPV vaccine protect us against all types of HPV virus?
It does not. So typically with the HPV vaccine, it covers the most common HPV strands out there. And so the one that we have in the United States covers the top 9 of the most common HPV strands out there.
And are there any side effects for HPV vaccine?
Typically not. So once a kid receives their HPV vaccine, we have them wait 15 minutes or so after they get it just to make sure they feel okay. Some kids, if they get up too quickly after they receive their HPV vaccine or any vaccine, they can kind of feel woozy or lightheaded. So that's why we watch them for 15 minutes after. But after that, there's not any long-term issues or anything like that. And HPV is actually one of our most studied vaccines we have out there.
And why should parents consider HPV vaccine for their children?
I think it's because it prevents cancer. So there's going to be a lot of things on the internet and a lot of things that families find out there. But I just want everyone to associate the HPV with a cancer preventing vaccine. So that should be one of the top reasons why families would want to do it.
And can HPV vaccine can be given to boys as well?
Yes, boys and girls, and men and women.
And like for any vaccination, like what are the key points as a parents I should keep note of after the vaccination is given to the kids?
More so when younger kids get their vaccines, especially when they first get their first set at around 2 months or so. After a kid gets their vaccine, they can be sleepy. So number 1, sleepiness is very common after babies get their vaccines. And number 2, babies can be fussy or have a little fever. Seen fevers go as high as 102, and it's still a normal response to the vaccines. And so those probably would be the 2 I see often after a baby gets their first or second set of vaccines. Typically older kids do just fine. They're going to say my arm hurts, of course, but outside of that, they should do just fine.
Fine. And what are the most common mistakes that new parents make with their babies?
I would say not a mistake because parenting is hard, especially in the beginning. And so I don't think I've seen parents make a lot of true mistakes, but more so just being nervous and anxious about their new baby. And so I try to tell families, give themselves some grace. It's going to be hard in the beginning, but it definitely gets better over time. And so the main thing I would say is give yourself some grace and patience, but no true mistakes or anything like that.
And what are the 3 foods we should strictly avoid giving to babies?
Sure. So the first food-ish, I guess it would be maybe sort of like a food, would be honey. And so typically we try not to give babies less than 1 honey. So that would be one thing to stay away from. The second thing would be, especially once babies start to eat solids, which is usually around 6 months, is any choking hazard. So hot dogs, grapes, popcorns, those would be the things to stay away from super young children. And that's probably up until 3 or 4 when they can really chew and swallow things well. And so not just babies. And then the last thing would be water, which is not a food, but a drink similar. And so typically we don't give babies water until they're 6 months or so.
And like, what are the three worst foods that for the child's development?
That's a good question. Worst foods, it's hard because I don't want to say foods are bad, but things that families probably should stay away from is processed food. And so there's a lot of, kid snacks and processed foods out there. So trying to limit how much processed foods. The second one probably would be kind of like foods, but drinks, so juices. And so I'm not a big fan of juice. It has a lot of sugar in it. Kids really just need milk and water. And so those probably would be the two things that are not the best for kids.
And like, coming to the allergies, what are the most common allergies in children?
Typically, I see kids, they're allergic to eggs, dairy products, and peanuts. So those are the top three I would say that I see mostly for food allergies for kids.
And what are the symptoms of allergies in children?
So typically when a child has a food allergy, the main reaction we see is a rash. And so like a baby or kid will have a rash or they'll break out in hives. It's not common that we see true anaphylaxis, which is like throat closing, vomiting, seeming like they can't breathe, lots of coughing. It's mainly a rash or hives in children. And then once that offending agent is removed, then the rash and hives go away.
Okay. How can I tell if my child has an allergy or a cold?
That can be difficult for sure. Typically with an allergy, like seasonal allergies, weather changing, kids will have sneezing, watery eyes, itchy eyes, runny nose. Typically with a cold, kids are not going to feel well, so they're going to feel sick. So they still might have some sneezing, runny nose, but they'll be coughing a lot more. Usually their throat hurts really bad, and usually they might have a fever. And so with allergies, I don't see kids have fever. I don't see them feel bad. They just feel annoyed that they have allergy symptoms.
And what are the food allergies and how do I recognize them in my child?
Typically with the food allergies is similar to what I was mentioning, like the rash and the hives and things like that. Especially when you're first giving a child food for the first time, those are going to be the things that you look out for. Now for older kids, they might, still have the rash and hives, but they can vocalize. So they can say, oh, my throat feels itchy, or I just feel off, or something doesn't feel right. And so they can vocalize and tell you that's how they feel. And that's typically what we see.
And how do the allergies are diagnosed in children?
Typically, it will be from a reaction happening. So they ingested a food and something occurred. And so then we would say, hey, you probably should, of course, stay away from that food. And then you should probably see an allergist. When kids go to the allergist, there's a couple ways that they can diagnose allergies. One would be pricks on the back. So like find pricks on the back and they see if they have a reaction to something. And then the second way is through blood testing. So if a child makes it to an allergist, they will decide what kind of testing they think is appropriate for the child in that setting.
Can children outgrow their allergies?
They can. Some allergens you are more likely to outgrow than others. So like dairy, I see a lot of kids kind of grow out of their dairy allergy or intolerance. Eggs, there's kind of plus or minus. Peanuts is probably one of the ones that I see that kids I guess the word is least likely grow out of. And so I don't see a ton that kids grow out of their peanut allergy, but especially dairy, those kind of things they typically do. Now with peanuts, there are lots of new trials and studies out there introducing kids who have peanut allergies peanuts. And so getting their body used to having a little bit over time. So then it's not as stressful if they go to a birthday party and there's some nuts around. They won't be so fearful because they've gone through this kind of what we call peanut challenge, where they can do and be exposed to a little bit, which has not been the case before. So it's really kind of changing things. And there's also new medications out there for food allergies as well that helps kids feel a little bit safer in different environments.
And what are the best treatments available for allergies in children?
Seasonal allergies?
Yes.
So typically it's the antihistamines. So those are the things like Zyrtec, Claritin, Allegra. I personally do not have a favorite, but I will say I probably use Zyrtec the most just because it comes in a liquid. It's easy to dose and you can use it as young as kids who are 6 months or so. And so those are typically where we start with treating of seasonal allergies. Now, if your child has a lot of just congestion, so everything's focused in the nose, then sometimes I'll tell families to do a nasal spray, something like a Flonase or a Nasacort. Those kind of steroid nasal sprays are okay for congestion type symptoms. And then if your child has just like allergic eye symptoms, so like their eyes water, they're very itchy, then you can do allergy eye drops, things like Pataday, Patanol. All of these things are over the counter now. So it used to require a prescription, but any allergic type relief your child needs, you can get it over the counter.
And how can I help my child to avoid allergens at school?
That's hard. It's definitely, so for younger kids, most schools or preschools, daycares, they have like an allergy plan. So it's going to be up to the teachers and those taking care of the younger children to know that they have this allergy they should stay away from. But older kids, I tell them to be an advocate for themselves. If they know they have a food allergy, they need to speak up about it. Ask questions, figure out what's in this, or, you know, just don't eat it, stay away from it. But they have to be able to vocalize like, hey, I have an allergy. I need to make sure X, Y, and Z. And, you know, us as providers, you all as parents, you have to empower your children to do that. You know, some children can be shy and reserved and things like that. But when it comes to food allergies, they can be very dangerous. And so it's something that you want your child to feel empowered about.
And what to do if my child has a severe allergic reaction?
Sure. The first thing, which is easier said than done, is stay calm. So you want to stay calm in the situation. If it's a severe reaction, like you're worried that your child is not going to be able to breathe, then the next thing you should do is call 911. So that would be if it's a severe reaction. Now, if they have a minor reaction, like they just have some hives or something, call your pediatrician's office. A lot of them are open even after hours. So just call them. And then typically I will tell families to have some kind of antihistamine on hand at the house. I like Zyrtec or the other antihistamines I mentioned over Benadryl, just because Benadryl can be very sedating, and some of the other antihistamines have been shown to work quicker than Benadryl. So having one of those on hand in case you need to give it for a hive or a rash would be fine to do as well. And then also I will say for severe reactions to food allergies and your child has a known history of food allergies or anaphylaxis, do not hesitate to use their EpiPen if you have one. It can really save their life.
And can allergies lead to asthma in children?
Typically not. So I do not see food allergies or even seasonal allergies leading to asthma, but I do see them I would say working alongside of each other. So a lot of kids who have asthma will have seasonal allergies, food allergies, eczema. It's what we call this allergic triad. So a lot of kids will have 1, 2, or 3 of them, not being caused by each other, but just the way that it presents in the body, you would have more than one typically.
And like if we are going to talk about the routine for kids, like what should be the ideal routine for kids in the morning?
I would typically think of it as the same routine that you do. So the things that you do in the morning, your child should be doing similar things. So as they get older, trying to wake themselves up on time, being able to do things on their own. So whether it's they take their shower, they put on deodorant. A lot of kids don't want to do that as they're getting older. Brushing their teeth, that's another big thing. You know, coming downstairs, getting their breakfast, helping pack their own lunch, you know, trying to be self-sufficient, especially as they're, you know, in elementary school and older. Those are kind of the things that they should be doing in the morning, similar to you.
And what is the ideal routine for kids in the evening?
It's similar to the morning, and so a lot of kids will pick out their clothes for the next day. You know, brush your teeth again is important. If you take your shower at night, that's fine as well. Making sure there's nothing that needs to be turned in or homework or something like that you have to do for tomorrow. So similar to what you're doing in the morning, you kind of do it at night. It kind of goes into sleep routine as well. So making sure your child has enough time to do their routine before they go to sleep so they can have a good amount of sleep at night.
Night. And how important is night bath for kids?
I don't have a preference on when kids take showers or baths. So it can be night or morning. It's just whatever works for your schedule.
And how many hours of sleep do the children need?
So it depends on the age, but typically kids who are in elementary school will do to middle school 10 hours or so, 12 hours. And then, you know, our high schoolers will do about 7 to 9 hours of sleep. That doesn't necessarily mean you go to sleep at 2 and then you wake up at 12. Like, we still want you to be going to sleep at the proper time so that you have enough time to get up and get ready for school.
And like, what is the most shocking experience in your career as a pediatric?
I think shocking in a good way would be just my interactions with families. So getting to know them, see their children grow up, bring their second and third child to me, just kind of being a doctor in the community. That's probably been the most shocking but rewarding part of being a pediatrician.
And how is sugar affecting the kids' health?
It's hard because sugar is everywhere. It's in everything. So it's hard to stay away from it. Sugar can cause a lot of different things. You know, it can increase the risk of obesity, like we were talking about earlier. Some families have said that, you know, they feel like their child's behavior is affected by sugar. Now, there are not any studies or anything that proves that sugar has this effect on behavior, but families know their child and this is what they see in their children. And so those are probably the two things that I see the most.
And how can I manage my child's anxiety?
I think it depends on why your child is anxious. It depends, and it's going to depend on the age of the child. Typically for like older kids, school can cause a lot of anxiety, and so figuring out why that's the case and what's going on with school, that's going to be an important thing. Or life stressors are also another thing that I can see that causes kids anxious, whether it's a move or a divorce, or especially a middle school friend group issues. And so figuring out the cause of the anxiety really helps kind of make sure you know how to treat it. Oftentimes I'll tell families if it's really affecting the child to, of course, start with therapy and things like that so the child can learn ways to help manage their anxiety. I have a lot of kids who, you know, once the trigger is removed or the stress or the anxiety gets better, but sometimes not, and they need extra help. And so I never hesitate to say, hey, let's work with a therapist or a counselor. And then, of course, eventually a child might need medication, but it's never something that we force our families or say that kids have to do. But you know, we do have some kids who have high anxiety and need medication to manage, especially with the mental health crisis that's going on, you know, not just in America, but in the world. Kids are really struggling, and so they need extra help.
Right. And what is the number one healthiest drink you will recommend for kid as a pediatric?
Oh, I think everybody knows the answer is water. I'm always going to say water, water, and water.
Yeah, that's right. I was thinking might be you were going
Yes.
to say something else. Yeah. And coming to the salary of a pediatric, like many of the kids, they want to become a pediatric. Even my daughter, she is 10 years old now, and she wants that I want to become a pediatric. And
nice.
she frequently asks me the question, Mama, what is the salary?
Oh, at 10, she asked you that.
So, like, what is the salary of a pediatric after doing studies?
So it varies, to become a pediatrician, you'll have to go through medical school for 4 years and then residency for 3 years. You do get paid in residency, but of course it's not going to be as much as once you finish. And so typically once you finish, it ranges. It can be, 100 and something thousand to start out, and then, or two, and then, as you kind of go throughout your career, it may increase as well.
So how it will be after 10 years of experience in pediatric?
You probably still will be making six figures, probably still similar to what you started out with. So.
Okay. And recently she has an app called iReady app in her school. So she read an article there that screen time is increasing or is affecting the brain health of the kids. So is it right?
Yeah, I think number one, screen time is not new, but we're seeing it more and more as the years go on. And because of that, we are trying to do research and studies to figure out exactly, is it affecting the brain health and how? I'm pretty sure it probably is, but we just don't know why or how yet. So there are more studies being done to figure that out.
And as a pediatric, what message you will like to give to the kids?
Sure. So being a kid is fun, and so enjoy it. It's some of the best times of your life. And also always listen to your parents and your teachers.
And any message for teens these days all over the world? Any message to teens?
Yeah. Teenage years are hard, trying to figure out yourself and what you want to do with your life going forward. And so try new things, explore new things, don't always say no to things. Keep listening to your parents, and don't feel pressured to do what society or everyone else says. Figure out yourself and, staying true in that.
And what message you will like to give to the parents as a pediatric?
Parenting is hard, so give yourself some grace and patience. It's hard, being a parent, especially in these days and times. And so know that you're doing your best for your kids, and you want the best for them as they get older. And so hang in there. It does get better-ish.
And one more thing, can there be any two ways you can tell to manage the kids' tantrum in teenage age when they are teenagers?
Sure. So hopefully teens are not having a lot of tantrums because if they are tantruming, that means something else is going on. And so we need to figure that out. But, oftentimes, especially for older kids, if it's something that the family's trying to figure out or the teen's upset, I would say, hey, try to give the teen some, not insight, but more so let them kind of be a part of conversation. So, they can help decide what they think is important. Of course, making sure it's within reason, but giving some teens some power and authority over their lives, I think is helpful because it kind of gives the reins some to them. So if something doesn't work out, they can say, oh, it's because of, me or something I chose or did. And so teens should not really be having a lot of tantrums, but, life is hard. They get upset. And so them just working on vocalizing their emotions and then having a sense of control as well.
Well, thank you for being on my show. It was pleasure to be here, and you have given such a good content. I think it will be very helpful for our viewers, parents, and as well as the kids who are going to watch this podcast. Thank you so much, Dr. Grimes.
Yes, thank you for having me. It was fun to talk about all the things I love.
Thank you so much. Friends, if you like any content in this video, please don't forget to like, share and subscribe. Thank you and have a nice day.